Welcome to the Pod of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours. Get down in the cave and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
My guest today is Dr. Alan Katz. He is a double board-certified physician in both hyperbaric and emergency medicine, and is a fellow of the Undersea and Hyperbaric Medical Society. Currently, Dr. Katz is the National Medical Director for Hyperbaric Medical Solutions and is the Director of Clinical Operations as well as Education and Research for all of the HMS locations. A particular clinical interest of Dr. Katz is to further explore the effects of hyperbaric medicine in the treatment of traumatic brain injury and anti-aging. Additionally, he incorporates the use of regenerative medicine and techniques such as IV vitamin therapy and PRP in combination with hyperbaric oxygen therapy. I think you'll enjoy this conversation I have with Dr. Katz, that we dive into the physiology of hyperbaric medicine and how this really works for the patient. He dispels some of the myths associated with topical hyperbaric therapy, and I know that you'll learn a lot. So please enjoy this conversation that I had with Dr. Alan Katz. All right, Dr. Alan Katz, thank you for coming on, and you're going to share a lot of your expertise about hyperbaric oxygen therapy and some of the other cool things that you're doing with regenerative medicine. But before we get started too much, tell us how you got into this space where you're hyper-focused on hyperbaric oxygen.
I like that, hyper-focused on hyperbaric. Perfect.
Yeah.
You know, honestly, it's been a long story for me. I've been in practice about 34 years now. In the beginning, I was practicing all emergency medicine. And hobby-wise, I really started to get into scuba diving a whole lot. And I would dive a lot of the Northeast. I was doing a lot of cold water diving, dry suit diving. And, you know, over the years, it became more of as long as I'm doing this, let me get some more training so I can figure out how to save myself if I ever need to.
Right.
Which really led to more training in hyperbaric medicine and eventually board certification in hyperbaric medicine. And it brought us along this pathway.
So how many years have you been doing hyperbaric medicine?
Hyperbarics, probably, I guess I'm up to about 20 years there now. I've been out about 34, 35 years. The first part was really all emergency medicine. Then I bridged more into a combination. The last 10 years or so have been pretty much 100% exclusively the practice of hyperbaric and regenerative medicine.
Well, hyperbaric's been around for a long period of time, and I think everybody's kind of aware of it, but I don't think they're really aware of a lot of the physiology that is going on with it. So let's talk about that. And you made a comment before we started recording that this is really a medicine. It's a drug, and it has to be dosed properly. And I'm assuming that dosage would include not only the ATA, but the number of treatments per week, the number of weeks of treatment, those types of things. So give us some insight on that.
Yeah. You know, absolutely. Again, it's important to understand that hyperbaric oxygen is a medication. And it's actually two medications. It's oxygen and it's pressure. And people tend to lose sight of that. And it's the correct dosing of both oxygen and pressure together that really give you the big response. And in so many different cases, based on how we manipulate those two, we can make different things happen physiologically. And it's interesting. It's one of the reasons that hyperbarics actually has a kind of a bad rap. And people look at it like, how can one thing fix so many different problems?
Mm-hmm.
And part of it's that hyperbarics itself is not fixing a problem, but the correct use of oxygen and pressure is changing physiology.
Right.
So that the body is able to fix itself. You know, and that's the biggest piece for it. You're about to do something.
Yeah. So when you said it's two things, it's not only the hyperoxygenation, but it's also the pressure. I'd never really thought about that. how is it that the pressure is a modality? I realize that you have to have pressure to get the increase in the plasma oxygenation. That seems to be pretty empiric. But is there another benefit of the pressure that I'm not aware of?
It's actually been studied separately. There were initial studies done by a guy named Malik many years back. And what you start to see is that even if you use, for example, room air or 21% oxygen, or in many cases, you could even go to a lower than room air oxygenation level, down to 15 or 16%. If you increase the pressure alone, you will make physiologic changes. There are many studies done on gerbils, brain injury, and things, just trying to show that the just manipulation of pressure alone starts to make major changes in physiology. The same thing is happening with oxygen. If you just start to manipulate oxygen level, you make many changes in physiology. But it's really that combination of the two, when used appropriately, that makes that biggest change. For the audience, even when I'm not sure that that everybody even always has a clear understanding as to what hyperbaric oxygen is. It's really breathing 100% oxygen under increased pressure. So when anybody is out breathing in the natural air, you're breathing 21% oxygen. It's under 1 atmosphere of pressure. That oxygen's coming into your lungs moving into your blood. In the blood, the oxygen's attaching to hemoglobin, getting carried around wherever hemoglobin will take it. And that's it. Just sitting in a normal room, your hemoglobin is already 97, 98, 99% saturated with oxygen. And everybody here knows when you've had the little pulse oximeter put on your finger, you have that high reading. That's the percentage of your own hemoglobin that's occupied. Just even adding a little bit of extra oxygen into the system takes that to 100%, but it maxes out. Mm-hmm. Using hyperbarics, you're now going to be breathing 100% oxygen under increased pressure. By increased pressure, we mean simulating being under the ocean. The deeper you go into an ocean, the more pressure that there is. And what's amazing about that process is that you're able to take oxygen, which is a gas, and compress that gas so that you get much more of it directly into tissue, bypassing your need for blood. Think about that. And that's an amazing concept. If somebody is inside a hyperbaric chamber at the appropriate dosing, 100% oxygen and pressure, they can survive without blood, completely exsanguinated, filled with a saltwater solution. They could live. They can't live coming outside of the chamber that way.
Right.
But there's enough oxygen in the tissue to support life at that point. So it's a very strange environment. What makes things even more different is what starts to happen with that extra oxygen in the system. And that's really the development of multiple oxygen-free radicals, which are uncharged oxygen ions flying around. And that's what kicks off this whole cascade of either changes in messaging, changes in signaling processes, different physiologic changes.
So let me ask you a question here. So we give the same, you're always giving 100% oxygen. Do you change the pressures depending on the conditions that you're treating?
We actually do use different pressures and different protocols based on different diseases that we're focusing on. In regards to changing the oxygen, again, that does change also, because one of the major mechanisms that we're using to create some of this change is putting the body through a situation where we fake the body out many times to make the body think that it's oxygen starved. It's the condition of paradoxical hypoxia. Okay. It's a condition where even though somebody is inside a 100% oxygen chamber, if we're able to lower that oxygen content a little bit, the body sees that there's been a delta or a change in oxygen. Okay. That delta or change tells the body that there's a problem. Something called hypoxia-inducible factor starts to increase, and that just sets off this whole cascade of events that we're trying to make happen. So we do manipulate oxygen level specifically for that. Pressures, on the other hand, we do different types of benefits at different pressures.
Okay.
I mean, as a generalization, some of the lower pressures that we might use, we find work much better on neurologic tissue. So when we're treating, for example, brain injury or neurologic tissue, we might tend to use a lower partial pressure of oxygen. When we treat other things, maybe somebody's had cancer. Their cancer's been treated with radiation. The radiation has not only done its job on treating the cancer, but it's damaged, unfortunately, some of the other surrounding tissue.
Right.
And they're having a problem there. We use a very high partial pressure of oxygen when we treat those cases. So we'll go back and forth. At lower pressures, for example, we might see major changes in inflammation.
Okay.
So everybody out there, right? The buzzword for this world, inflammation.
Right.
Scientifically, that's interleukin 1, 6, 17, fancy words for things that are causing inflammation within the body. We can very quickly lower those numbers, lower the amount of inflammation using hyperbaric oxygen. And many times we do that with a fairly low dosing of oxygen partial pressures. On the other hand, if we're looking to grow blood vessels, the process of neogenesis or angiogenesis, we might use a much higher partial pressure of oxygen.
Okay.
So it moves around.
Right.
Based on what we're trying to achieve.
Let me ask you a question about this the hypoxia inducible factor, because I came across that and it seems like an interesting physiological mechanism, but can you give us a little bit more insight on that particular protein? I would assume that it's a protein.
Yeah, it is. And it's interestingly enough, it's only been the last 5 or 6 years that we've had a much better understanding as to what HIF or hypoxia-inducible factor is all about. The Nobel Prize, not so many years ago, was awarded for a group of scientists who came up with a better understanding of HIF. But what HIF is doing is that the HIF it's a protein that when upregulated, it starts a cascade of events that changes a certain amount of physiology. And the main driver to increase HIF is a lowering of oxygen content. So when we have somebody who has a lower oxygen level, their HIF tends to drive. When their oxygen level is high, HIF tends to go in the opposite direction. HIF starts this cascade of events. For example, we were talking a minute ago about growing blood vessels.
Right.
One of the ways we grow a blood vessel is by increasing something called vascular endothelial growth factor, or VEGF.
Right.
The way that we get VEGF to increase is by triggering HIF. If we can get HIF to start to increase, that bumps up VEGF. VEGF starts the process of angiogenesis, or the growing of blood vessels. So it's really a cascade. What I was referring to before about changing the oxygen level in order to make that happen more is that we have found that if we can just make little changes in oxygen level, where an oxygen starts to fall off a little bit, that in itself triggers a bump in HIF. And what makes this a very paradoxical experience, if you will, is that we don't necessarily have to put you into a hypoxic or very low oxygen environment to do that. We simply have to move from a very high oxygen content back to maybe a normal oxygen content. Or we have to do a hyperbaric treatment, and then the next day you're in a non-hyperbaric treatment. But there's been a change in oxygen partial pressure.
So it's almost like an oscillation.
We actually use protocols specifically to create that oscillation a little bit more often, because the current belief is that if we can use that multiple times, we're going to get a bigger effect.
Okay.
And that's still actually under research. There's arguments put forth that say that wouldn't happen as quickly, and that might be more of a 24-hour or a 48-hour process as opposed to a few-hour process. putting it it's up for debate right now. But it's certainly part of the way most of us in hyperbaric medicine treat patients.
All right, so let just so that I can get a better understanding and the audience can maybe understand this a little bit better. Let's compare a case of osteomyelitis that you might be treating with hyperbaric oxygen versus a TBI. So you're telling me that with neurological, you're going with a lower pressure because it's a better dosage for that particular tissue. Would it be a higher pressure, longer duration, number of treatments if you're trying to get the antimicrobial benefits?
Yeah, again, all yes. Yes, all of it. Again, there are some processes where we'll treat somebody once or twice.
Right.
There are other diseases where we'll treat 30 or 40 sessions. For example, when you were talking about osteomyelitis, which is a chronic refractory bone infection or deep bone infection, we typically treat with high partial pressures of oxygen, and we need to treat for a long period of time. But more importantly, it typically needs to be done concurrently with the correct antibiotic therapy, with the correct wound care and debridement.
Right.
It's not a treatment on its own. And that's forgotten so often. Hyperbarics alone is not the end all.
Right.
Hyperbarics is not the magic fix. Hyperbarics needs to be used to change physiology to support any other treatment that you might be using.
You know, when I was looking at some of the stuff prepping for this conversation with you, after, looking at a lot of things, I was able in my mind, and maybe this is incorrect, but I drew a lot of analogies to ozone therapy, where ozone can do very, significant beneficial things, but it's not a standalone. It has to be combined with other things. So it can mitigate certain effects of radiation if it's administered before the radiation, certain things like that. But it's, at least my understanding with ozone therapy, there's almost no reason if it's properly used that it won't be beneficial, but it may not be the magic bullet. You still have to do all of the other things that you would in a treatment care plan for a specific condition. And then that's kind of like adding the super catalyst to things. Is that fair to make that analogy, or am I all wrong there?
Well, I mean, part of what you're saying, I would agree with. I tend to put ozone in a different bucket than hyperbaric oxygen. Ozone therapy, it is oxidative therapy.
Right.
Obviously, as is hyperbaric oxygen. It's administered in a different way, and there's much different science that supports the two. In regards to hyperbaric oxygen, both from a safety standard, from an FDA approval standard, from a standard of care use standard, it's an approved treatment. There are many treatments that we will use it for that might be considered off-label, meaning FDA not approved for that particular treatment, but it's a very well-established, heavily researched treatment modality. Ozone, there is no FDA-approved use for ozone in the United States. It's used much more in Europe. There are many people using ozone in the States, and I don't think the science is as robust. I think done the right way and by the right person and for the right indication, it's a great tool. But the only thing it's doing is changing the oxidative stress. It's not changing any of the other potential, we're not seeing some of the other potential benefits that have been now proven in hyperbarics. Everything from, let's say, telomere lengthening to even supporting mitochondrial function, gene regulation. We know that based on different protocols that we use within hyperbarics, we can up or down regulate upwards of 7,000 or 8,000 genes to make a difference. I don't know that that's really been proven or that science supports that in the world of ozone. Stem cell release.
Well, I wasn't, we'll get to that in a second. I wasn't trying to compare ozone to hyperbaric based on a treatment modality. I was trying to compare it, and I was probably very poor in my explanation, but it was that ozone is an additive therapy. You can add it into other treatment plans, and it's going to be maybe more beneficial than if it wasn't incorporated, but it's not the end all be all. It's not the standalone magic bullet for a lot of things. And hyperbaric, if I didn't misunderstand what you said, is that you combine it with other things like the debridement, the antibiosis that you're using. Let's say it's an ulceration with osteo. It's an additional treatment that is very beneficial. I wasn't trying to compare them apples to apples.
Yeah, no, I understand.
Yeah.
You know, the other thing is there are some things where hyperbarics would be considered a primary treatment.
Right.
So
Obviously.
For example, if you had let's take like a carbon monoxide poisoning, for example, where the use of hyperbarics by many would be considered the primary treatment, because it's that use where you can displace the carbon monoxide from the hemoglobin molecule very quickly, and you get some reversal. Same thing might be with things if somebody has a very big embolism, like a gas embolism, whether it's iatrogenic caused in a hospital setting or somebody out scuba diving. Again, the quickest way to take a bubble and shrink a bubble to get it out of the way would be to put that person under pressure, i.e. hyperbaric oxygen. So, you have things where it is the primary. But yeah, in most indications, hyperbarics is part of a treatment package. It's just like combining with any other group of medications to try to, create resolution. Again, it's the physiologic changes that are being made. And that's the part that everybody has to just, hyperbarics doesn't fix osteomyelitis, but hyperbarics will start to change the survivability of different bacteria. It's going to change the efficacy of different antibiotics. It's going to increase, new bone formation. In many regards, it's going to increase the blood supply to the, so behind the scenes, it does a lot of the work. It doesn't get all the credit, but it does a lot of the work.
Right. Well, one of the things that I came across that was a little bit paradoxical, and maybe you can give me some insight on this when we're talking about neogenesis and that, is that it appears that that there's a component of vasoconstriction that occurs with administration of hyperbaric oxygen, but at the same time, are you circumventing that because you got such a great saturation in the plasma? And like you said, you don't even need blood technically if you have the right saturation. Is that true, that it is a vasoconstrictive process?
Again, it's one of the beauties of hyperbarics is that we can knock down edema very quickly by causing some vasoconstriction. And the understanding, to take that a step farther, though, that's going to happen in an area that is that has a blood supply that is well oxygenated. When you move into areas that are ischemic, you are not getting vasoconstriction. In the areas that are ischemic, you have higher content of nitric oxide, which will be released. If anything, you're going to get kind of a local vasodilation in that area. So a combination of having all that supersaturation and extra oxygen around, and the contributory effects of things like nitric oxide giving local vasodilation, it's a win-win. So overall edema, swelling goes down, but the hypoxic tissue or the low oxygen tissue improves and does better.
Gotcha.
So it's kind of a little bit of a twist. I've heard that from many patients over the years, saying, you're going to shut off my blood supply.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called Stem Regen, which I take daily and genuinely believe could revolutionize your health journey as well. Stem Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. Stem Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating Stem Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that Stem Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of Stem Regen.
Yeah, I think that then, makes you go back and think about the miraculous nature of human physiology. I mean, look at some neurotransmitters, for example. In some areas of the brain, they're inhibitory. In other areas of the brain, they're excitatory. I mean, how did that design come about? It's really kind of miraculous when you look at it. But
it's all about balancing everything. Yeah. And in hyperbarics, again, dose matters. Too little oxygen in general, bad. Right. Too much oxygen, bad.
Right.
Again, at a very high, it's all balancing oxidative stress. Inflammation needs to be balanced. Oxidative stress needs to be balanced. The human body and everything, whether we're looking at longevity, anti-aging, health and wellness in general, it's about balancing those processes. And it's too much or too little is no good. Part of the problem that we see is that there's too much oversimplification sometimes of some of these tools that we have, where people start saying, well, if hyperbarics is good, then let's just hop in there whenever you want, or set up a chamber and just jump in the chamber without looking at the risks, the benefits, the alternatives, and does it make sense? Does it not make sense? Is it accomplishing what you're trying to accomplish or not? All I ask is that if somebody is using hyperbarics, understand what it's doing, what it can do, what it should be doing, and use it to the best to its best function.
Right.
Make what happen, make that change happen that you're looking to make happen. If you're looking for a process of angiogenesis, understand that 5 or 6 treatments are not going to create the little capillary buds. That's going to be a longer process.
Right.
If you're looking to treat late effects of radiation, it's a longer process. If you had an acute concussion, for example, we might only need 2, 3, 4 treatments to turn something around quickly, where a later presentation might be different.
Have you seen an expansion of the medical indications for hyperbaric over your last 20 plus years using it? It seems to me that when I first got in practice, it was if we had a diabetic foot ulcer or, some kind of an osteo or something like that, aside from the emergency scuba diver applications that were well known back then, seems like there's more indications for it now than back then. Am I wrong?
Honestly, it depends on what you're really looking at. If you look at it from an FDA approved standpoint, right now you have about 14 indications that are considered approved use for hyperbarics in the United States. It's actually much higher in many other countries, lower in some, but higher in many other countries. That number hasn't changed all that much. So I started in about 1990 or so. That number has not changed all that much. What has changed is that there's been more and more science, more research, more of an understanding of hyperbarics, and the ability to apply it to different disease processes. In a hospital setting, though, again, I don't know your background well as far as to whether you had an office-based practice or more a hospital, but in a hospital practice, you're only going to see hyperbarics used for those 14 indications. You're not going to see it used for the multitude of indications where we use it in an outpatient setting.
Right.
For example, hospital, yes, for the diabetic foot wound that meets certain criteria, yes, for the osteo, yes, for the radiation injury, yes, for the carbon monoxide, yes, for the significant burn patient, yes, for the surgical flap or graft that's failing or compromised. You have your standards, but in an outpatient setting, we're using hyperbaric oxygen in an investigational fashion, if you will, for brain injury, for concussion, for health and wellness.
Right.
And beautiful studies came out several years ago showing a nice protocol for anti-aging, for telomere lengthening.
Right.
That's not an FDA-approved use of hyperbaric oxygen, and it's not going to happen in a hospital setting, but it does in an outpatient setting when done properly. The treatment of diseases like MS or post-stroke that we treat. In the world of cancer, there is some standard of care uses of hyperbarics, and that might be things where, for example, we're treating the late effects of radiation. But we often now use, at least in my practice, I often use hyperbarics as one of the oxidative stress therapies for a patient that's specifically in like an anaerobic state of their cancer process. And that's a patient that we might use things like high doses of intravenous vitamin C, artesunate, hyperbaric oxygen, different ways to try to use oxidative stress to help destroy a tumor outside of standard of care, meaning surgery, radiation, and chemo.
Right.
So, and again, that's not an FDA approved use, and it's not a use that you would see in a hospital setting. But not FDA approved doesn't mean bad.
No, in fact, I would argue that there are probably more conditions that are treated off-label than by far than what's FDA indicated.
Yeah, exactly.
What's the absolute? I mean, I know what the absolute contraindications to hyperbaric oxygen therapy are, but you want to go into a couple of the things that you would say this is not a good thing for this particular condition or patient who has this condition.
Well, I mean, you have the one biggie, and really the only absolute is somebody with an. Can you hear me now?
Yeah. No, I was just saying the tympanic membrane.
Oh, no, that's actually nothing. That's a little low problem.
Okay.
A pneumothorax.
Okay.
Somebody with an active pneumothorax should not go into the chamber. Why? If you, for the audience that might not be medical, a pneumothorax is just some air outside of the lung, between the lung and the rest of the chest cavity. If you have air in that space, and that air in that space is at a certain volume, what do you think happens as you start to come out of pressure? Right? Think of a balloon. If a balloon is sitting in pressure and it's this size, when it comes out of pressure, it's this size.
Right.
When it's this size, it ruptures. That rupturing can create something called a tension pneumothorax, which is a life-threatening condition. Outside of that, everything else in hyperbarics is really a consideration. There are multiple, there are relative contraindications, and there are many things where when we do a risk-benefit alternative analysis, we'll decide to either treat or not treat at that time, but not an absolute. You mentioned years. A very small percentage of patients have trouble clearing their ears when using hyperbarics. The first 10 minutes of a hyperbaric session and the last 10 minutes of a session are similar to being in an airplane during pressurization and depressurization. So during that time, patients are going to yawn, swallow, pinch their nose, do things to get their ear to pop.
Right.
Most patients, that's not a problem for. The occasional patient is having some pain. If they're having pain, a treatment is stopped at that point. Pressure's backed off. They're given time to equalize. The rare patient, we can talk to about putting tubes in, the same tubes that we use for babies.
Right.
Again, are we going to talk about tubes for somebody who's doing hyperbarics for health and wellness, anti-aging?
Right.
No. But if somebody had a horrific amount of hematuria because of a radiated bladder and it's requiring transfusions, and we know that hyperbarics, which has an 80% success rate there, is going to be useful, then we might talk about it too. But again, small numbers. We treat babies. We treat, we treat 1-year-olds. They just very naturally clear. Like, how many people worry about their ear perforating before they get on the airplane?
Not many.
So again, not as big a thing as what's out there. There are other little things to be on the lookout for. Long courses of hyperbarics start to make some changes in vision. Far vision actually gets a little bit worse. It's typically temporary. 99.9% of people within a few months of stopping will go back to where they were. But it's to be noted, if somebody has cataracts, sometimes cataracts could get a little worse during the course of hyperbarics when we're treating a long period of time.
Right.
There's something even called oxygen toxicity. 1 in 15,000 people, which is really a lightning strike number, can start to develop a seizure-like activity from exposure to high oxygen. It's very rare. We don't see it often, but it's part of why you should always be treated in a medical environment where you have somebody around who can take care of you, should that be the case. Not putting that out there to scare anyone, and that's usually in patients that have underlying neurologic issue.
Right.
But it could happen, and it does happen. In regards to other things that we think about, that you had mentioned, let's say devices. Like, can a pacemaker go into a hyperbaric chamber? Can it not? We have to check. There are some pacemakers that can and some can't. You always have to make sure that anything going into a chamber can tolerate that pressure change and won't break down.
Right.
Pacemakers, defibrillators, pain pumps, medicine administration equipment.
Right.
Sugar. Hyperbaric oxygen makes somebody much more insulin sensitive. So glucoses typically start to drop. Sugar drops. A typical diabetic patient going into a chamber can easily drop 60 or 70 milligram per deciliter by the time they pop out, which is why all patients that meet that criteria, they're going to have their sugar monitored before and after a finger stick.
Right.
You're starting out at 100 and you're a diabetic, I probably am not going to put you in the chamber.
Gotcha.
I'm going to wait till I creep it up a little higher, knowing there's a good chance it's going to drop. So if you look for these things and you protect against them, all is great.
Gotcha.
Fire risk, right? We're using a lot of oxygen.
Right.
We're using a lot of oxygen, so we stay very careful.
Right.
Nothing goes into a hyperbaric environment that's flammable, combustible, or lit off gases. What does that mean? I don't want hair extensions. I don't want silk eyelashes. I don't want makeup, no perfumes, no lotions, no nail polishes. The only clothing going into the chamber is 100% cotton gown that patients are provided with. We even go so far as to make sure that there could be no static risk.
Right.
So we put static bracelets on patients and then ground them to the chamber. The chamber is grounded to the building to get rid of static.
Right.
So everything's done just to take oxygen and pressure, take those two medicines together, and provide it to the patient in the absolute most safest way you can give it. And that being said, it's probably the safest medicine out there, as long as you've thought about those things.
Well, that's true for a lot of things, right dose, right indication, and it's a great treatment or great drug. But if it's used improperly, it can be a disaster. Even the most simplest thing can be screwed up.
Yeah,
for sure. So
Yes.
I got two more questions for you. One is what's your thought process on these topical extremity chambers for like diabetic foot ulcers? I mean, to me, it just doesn't seem like it's going to really do that much because you're not going to have the systemic effects. But what's your take on that?
I just say like ditto. Look, hyperbaric oxygen, 100% oxygen under pressure. Your entire body is in the chamber. Topical, there are, if you flip through magazines, you'll find chambers where somebody's leg like is inside a chamber.
Exactly.
Again,
Yeah.
there's no science to support that use, not that I'm aware of. It's certainly not hyperbaric oxygen, and if there is anything proven down the line, it's going to be under a different mechanisms. But it's not the mechanism of, or we don't believe it's not going to be the mechanism of mitigation of an inflammatory response, angiogenesis, stem cell release.
Right.
These things are not really. So right. I would not give too much credence, to that at this point. It's if you use hyperbaric oxygen, it should be used the way the research has shown it can be used. Right. This brings to mind, you'll see, there's also the division between whether you're using a monoplace chamber, or a multiplace chamber,
right,
or even what's called a mild chamber,
right,
for that matter. And for the audience, I mean, a monoplace chamber is using an oxygen chamber that accommodates one person. So it's a chamber that's typically compressed with 100% oxygen, and that chamber itself is compressed. You can take it up to 2.5, 3 atmospheres of pressure, and you're able to provide hyperbarics that way. The multiplace chamber is typically a room-sized unit. You can take even upwards of 5, 10, 15, 20, 25 patients, depending on the size of your chamber. It's compressed with air, and patients are then wearing oxygen, whether it's a hood, so it's a full hood that seals around the neck, or an aviator-style oxygen mask, which is that mask that comes right on that straps down very tight.
Right.
Not a regular oxygen mask that you see, on patients, in the hospital setting. But it looks more like a pilot's, mask.
Yeah.
But to do that, you can do that. Mild hyperbaric chambers exist, and that's chambers that are typically soft. Some are firm, but they are designed for pressurizing to maybe 1.5 atmospheres. Some say they go to 2 atmospheres of pressure. They're being compressed with air, and many of them are then having supplemental oxygen being supplied by oxygen concentrators. They're approved for use in acute mountain sickness. There is no mild chamber that has FDA approval for use in the United States for any other reason. They're out there. They're everywhere. And it goes back to what I was talking about with understanding what it is that you're actually treating with. And just because it has the word hyperbaric in it doesn't mean there's hyperbaric oxygen and there's hyperbaric oxygen. There are different things that you're achieving.
Right.
There's different safety standards. There's different oversight standards. It is what it is.
So in the hyperbaric biohacking world, there are a lot of people that are putting their own chambers in their house, and some of them I think are what you refer to as mild pressure. What's your thought process on the biohacking longevity aspect? You talked about telomeres potentially, changing for the positive.
Yeah.
What protocol would somebody have to say, like they just want to try to hit longevity, or they want to improve their health span?
Yeah, again, well, the published information there and following the literature would tell you that you would treat using a pressure protocol that's the equivalent of 2 atmospheres of pressure using 100% oxygen, a 90-minute at pressure treatment protocol, about 10 minutes up, 10 down, 90 at pressure, with at least 3 oxygen fluctuations in the middle of that 90 minutes. And you're doing this somewhere between 40 and 60 times, depending on which protocol you've attached yourself to.
Right.
That's the protocol that has shown upwards of a 20% bump in telomere length. That's the protocol that's been studied looking at different, everything from executive function, reaction times, all the other pieces that you're looking for.
Right.
The use of, let's say, mild chamber or lower pressures or different things, or not using protocols where you're creating paradoxical hypoxia, all that stuff that we spoke about.
Right.
It's untested. And we also know that it doesn't make the rapid change that you might be thinking. But for example, we have done our own research, some of which is published and some isn't. Let's say, stick with, let's say, stem cell release.
Right.
A single session and 2.4 atmospheres of hyperbaric oxygen treatment protocol, a 90-minute protocol, will double circulating stem cells. That was shown initially by Steve Tom. I think it was like 1995, University of Pennsylvania, a very landmark NIH big-time study. So that catches on, increased stem cell.
Right.
You do it for 20 sessions, you can go up about 8-fold. But now let's take that down to maybe a 1.3 atmosphere compression, which would be a standard soft chamber that's out there. To get to a doubling, based on measurements, you would require a little over 2 weeks. So it takes about 2.5 weeks of treatment to potentially get to a stem cell doubling, if that was your goal.
Right.
Where that was accomplished in 90 minutes, on the first day.
At a higher atmosphere.
Great chamber.
Right.
It's just different. It's different treatment that you're doing.
Now you're also combining hyperbaric with some of your regenerative techniques. Do you want to touch on that a little bit? Because I think that's very interesting.
Yeah. Part of what we do in regenerative medicine is we're trying to fix all, or putting the body into a position where the body can better fix itself.
Right.
So in regards to something like that, I spend a lot of my day working with platelet-rich plasma. For example, platelet-rich plasma is just a highly concentrated serum of somebody's own platelets. So if we draw somebody's blood and concentrate their platelets and then inject platelets to an area that's injured, we know that platelets then start to attract to them all sorts of helper cells, specifically stem cells. Right. And it's the way the body repairs itself even without us. If you have a laceration, platelets end up congregating in that area, causing that blood clot, and that's where most of our thought process usually stops. But that blood clot or a constellation of platelets has now locally started to release different signals, which brings to it fibroblasts to lay down collagen, stem cells to grow other tissue, and it's just the natural process. Using regenerative medicine, let's say somebody has a tear in their supraspinatus, part of their rotator cuff.
Sure.
We see that under ultrasound. We know where it is. We draw their blood. We concentrate platelets. Under ultrasound, we inject the platelets right back at the site that's injured. And then as part of my protocol, I then use a single session of high partial pressure oxygen right after that injection.
Okay.
Why do I do it? Because the process works by attracting stem cells to wherever I injected. I know that I can, instead of putting somebody right back in the car and sending them home, I can double their circulating stem cell, at that point.
Right.
Some of this is studied, some is not. It's still in its infancy, treatments like that, but it's used in that combination to try to create that success. And totally works very well. I think we have a very high, or higher than even expected sometimes, success rate by doing things like that. But it's really, it comes together, for those reasons.
No, that's very interesting. We were actually some of the first, maybe the first in the United States to use PRP for plantar fascia.
Works very well.
And it worked very well. And And, then we would combine it with other things like extracorporeal shockwave therapy.
Uh-huh.
And it was just you were just stacking, you're just trying to, and I think that's the key to regenerative medicine is, like you say, you're adding things, and you're stacking them up. So,
we do that all the time. Again, with plantar fasciitis, same thing.
Right.
PRP with the treatment or two, big difference. Again, I have access, obviously, in my practice to the medical grade chambers, so it's easier to make happen.
Right.
But it's a very nice 1-2 punch for everything.
Right.
We use that in aesthetics.
Yeah.
We're using PRP for aesthetics. Same thing. We'll combine it many times with hyperbaric oxygen. Again, we're just trying to use every tool that we have to let the body fix itself.
Yeah.
That's the whole process.
I even know some plastic surgeons pretty well that after a facelift, they will send them over to their hyperbaric center for 2 or 3 treatments after their facelift to accelerate healing.
Yeah, we actually, for years now, at all of my offices, we treat both before and after elective surgery.
Makes a lot of sense.
Pretty much everybody in Hollywood and every professional that you see on TV and sport, before they have anything done, it's hyperbarics, procedure, follow-up hyperbarics, fly home.
Oh,
it's just a way to rapidly to accelerate what the body does naturally.
Yeah. So, Dr. Katz, can you tell everybody how they can get a hold of you and find you? I know you're in New York. And
actually, I have offices. I have one on Long Island. I have an office in Manhattan. I have an office just outside of Boston. I have one in Fort Lauderdale. I have another one in Miami opening actually next week.
Wow.
My website is alankatzmd.com, ALANKATZMD.com. The practice is Hyperbaric Medical Solutions.com, and that's all one word, Hyperbaric Medical Solutions. You can reach out to me on LinkedIn. I'm at Alan Katz, MD, ALANKATZMD on LinkedIn. And that's probably enough ways to find me.
I think they'll be able to find you. Thank you so much for coming on and sharing this great expertise, and really appreciate that.
A pleasure. I hope you found some use.
Oh, I think the audience will resonate with this quite well. Thank you.
And now a message from our sponsor. Well, folks, if you're over 40 and you're not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to health, not to mention the cardio protection. Nitric oxide is a physiological molecule that does so many things for your health. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, just go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration, and I am certain you will be pleased not only for yourself, but for all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see that nearly every one of them will be deficient. When they see this result, they will want you to start them on it immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates. Thanks for watching. You can start today. I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the pod of inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The pod of inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.